Assalamu alaikum, everybody. Today we are going to talk about conveying bad news or breaking bad news. Today we are going to learn important items. This will be related like what is bad news, examples of bad news, how can we do this clinically, what should we not do, how to respond to challenge question. This is very important, not just for breaking bad news, but for the clinical encounter. Also, we will take like some important items in the history, like how can we introduce ourselves, how we can empathizing with the patient, how can we address the privacy and confidentiality, how can we do recommendation. So actually, this is very important for all of your clinical practice, not just for this semester. I will be happy to be with you today, and I hope you enjoy this clinical seminar. So let's going. What's the bad news? Any news that seriously and adversely change the patient view of his or her future. The degree to which news is bad depends on the gap between reality and patient perception. So, what can be this news, make this news bad or not, is depending on the patient perception, and also it can depending on um, like also in the fact of this, but how is the gap between the reality and the patient perception making the things like either pass well or it making it more severe. So what's the examples of bad news? Like as we think this patient, she is having life-threatening illness like cancer, HIV, like degenerative conditions like Alzheimer, dementia, chronic illness like rheumatoid arthritis or systemic lupus, mental retardation in children like Down syndrome or cerebral palsy. So, how can we do this? How can we do when we're having a patient with like we have to deliver something that can hurt his feeling, like a diagnosis of chronic medical condition, or the patient is waiting for the investigation. So how can we do this? How can what are the approach? How we deliver this information to the patient? First, we have to prepare the setting, the perception of the patient, how much he know about this, the invitation, the knowledge, the empathy, and the summary and the strategy. This is called the spikes. So the spikes uh, is a mnemonic that we use for the skills of delivering bad news. So the setting, first, we have to introduce ourselves. We have to arrange for the privacy. We have to involve significant other and sit down. This is we are going to discuss about later about one slide about the introduction. So this is very important. So when we have a patient, like we have to introduce ourselves. My name is Dr. Mohammed. I am a psychiatric resident and I will be with doctor for today. I am going to ask you some question regarding your condition and then I will discuss it with you. Or I am here today to let you know what are the result of the investigation and discuss it with you. So, are you comfortable on the room? Everything is okay. Would you mind if I write some notes while we are talking? Can I can I have a seat? Okay. Something like this. So the perception of the condition, ask what he already knows. How much do you know about your condition? And you have to listen to the level of comprehension. You have to accept denial, but don't confront at this stage. Invitation from the patient to give information. Ask the patient if he or she wishes to know the details, and if you want to do this, do you know it? Do you want to know it, uh, like little by little, or like do you want to know all the information or some of them? So like this, accept the patient right not to know. Offer to answer question later. Knowledge, giving a medical fact. Using language intelligible to the patient level. So when you give the patient this information or investigation, you have to uh, tell him this information in a simple way, what we call it in a layman language, not to use like a medical term because the patient doesn't understand this. Keep it short, give one information at one time, then keep a silent, then tell him more. Check every time. Do you understand me? Do you get what I am telling you? Give facts accurately about treatment options so you can discussing all of this. So the emotion and empathy show emotional support towards the patient. I'm so sorry about what I'm going to say. Uh, Mr. Smith, now I'm going to tell you what I'm thinking so far. But first, let's start with the good news that we have today. So, like, I know it is very hard situation. Anyone in your position would have the same. Okay, so all the time when you're saying something like awful for the patient, you have to say, "I'm so sorry about this. Are you okay? Are you fine?" So the empathetic response, but not necessary for you to agree to the patient point of view. Physical context like the sitting, the body language, the eye contact, this is all are important. Listening skills, the strategy and the summary when we do closure for the interview, and this is we will revise this, that we have to close the interview, ask whether they want to clarify something else, offer agenda for the next meeting. We are going to discuss how we can do the closure soon at the end of these slides. So what we should not do: inadequate time or information. You should give the patient his time. Failure to elicit the patient understanding of the situation. Giving news at the doctor's speeds. Not allowing time for response. False reassurance about the future. Allowing denial to remain. Removing all hope. This is, we should not do this. We should always instilling hope for the patient. Be patient, be patient, be patient. Try to ask the patient a lot if he understands this or not. So this is all are important. So this is the introduction we mentioned before. So I think it's okay. This is the transition when you're going from a certain stop at the history to the other. We have to saying thank you. Now I'm going to ask you some questions regarding the past medical history, the past surgical. So all the time we have these are very important professional skills we have to cover in the history taking. In the recommendation, there is like stops of recommendation when the patient like having problem with the substance. I would like to tell you that smoking and drinking alcohol are very bad habits. They are dangerous to your health. They may cause many diseases like lung cancer, liver disease. Mr. Gray, I'm really concerned about your health, so I recommend you to quit smoking and drinking alcohol. If you wish to stop, we have a very good support team that willing to help you. Is it okay with you? If the patient even doesn't like to stop smoking, you have to say, um, I understand what you feel right now, but at least try to slow down your or try to decrease number of cigarettes or decrease number of alcohol you drink. And once you would like to stop, I will be more than happy to do this. Also, the recommendation can be used in the area of sexually transmitted infection or in HIV. I recommend you be tested for HIV, and if you want, I can run this test for you, but I need your consent. Also, make it's my recommendations that you take medication as prescribed in order to prevent many complications. Um, all of these steps are very important for you as a clinician in order to do. So you have to know the introduction, the transition, the recommendation, the embassy. For example, when we ask him about the family history, are your parent alive? If no, I am so sorry to hear that. What did your father or mother die of? If his father or mother died from cancer or something awful, you have to say, I am so sorry to hear that. It must have been very difficult time for you. If they are alive, yeah, I am glad to hear this. Privacy and confidentiality. When you ask the patient questions related to his personal life, either his drug history or sexual history, you have to address the point of confidentiality. Some of you using this from the start of the history. So when they start doing the introduction, they tell the patient, Mr. Gray, I want to tell you that everything will kept confidential. The rest and will everything we will talk today will keep confidential. So please uh, don't worry about this. So the closure of the summary, like when we mentioned this, I have when this you have to learn this if you are going to doing this in all your OSCE station and in your clinical practice. You have to thank the patient for his cooperation and you have to summarize. You have to say the main complaints as the patient saying, and you have to saying three positive confirming this and the three negatives that not present, and then you say, I understand your problem and everything I can do to make sure you feel better because your health and safety is our main concern. Here we try to make the patient reassured. Then you have to tell him about his diagnosis based on history and physical examination. You may have, here you should not say a medical term, should say, for example, a swelling in your lung, infection in your lung, chemical balance in your brain, which we call it in medical term this, and you have to give the explanation about this. In order to rule out this possibility, we will run some blood test and take a picture, for example, of your lung, take a urine test, and if and when I get the result, I will be able to give you the diagnosis and treatment option. So this is like you because at this stage we doing like a provisional diagnosis but not final diagnosis. Do you have any questions for me? If there is anything I can do to make you feel more comfortable. It was very nice to meet you. Have a great day. Thank you very much. The nurse will be with you very soon. So, this point is important because when you are doing like a clinical encounter, either in breaking bad news or general clinical encounter, we're all the time exposed to a challenge question with the patient. This question can be around the illness of the disease. This question can be around diagnostic tool. This question can be around the treatment option or other. So let's going. If the patient asking me like, doctor, do you think I have cancer? Do you think uh, I have angina on my eye? So if you ask this well, you just take the history. You have to say, understand your concern, but first let me finish the history and the clinical examinations, then I am going to tell you. Don't answer this from every. If uh, if he asked while at the end of the encounter, you have to say based on your medical history and my exam, like it can be a remote possibility to having this, or based on your medical history, uh, you have to tell him like we are thinking about them, and the next visit I will be in a good situation to answer you the question regarding this. So this is example. Young patient who had a dry cough and chest pain that have started after common cold. The pain is mild for over 10 and worse with taking deep breaths. So usually this is like, if we think about this, this is like below zero inflammation of serous membrane. Then the patient saying to you, doctor, am I having something serious in my heart? So you have to tell him like there is two ways you answer. You can first like asking him, you can answer this like, why why do you think that you have something bad in your heart? Then the patient can say, oh, doctor, I have my father that died from angina or my uncle, and I'm really worried about this. Then you say to him, oh, I understand your concern, but based on what you have finding, you having this and this and this. So this is mainly due to inflammation in your membrane around the lung. This is a way you answer. The other way is like written here. Based on your history and MRI exam, it's a remote possibility to have something serious in your heart. You are young and you don't have risk factor for this. The pain is suggestive of inflammation. However, I could not eliminate anything else. To be sure, I will do this next visit. I am going to tell you the final diagnosis. Am I addressed your concern? Example two, old patient, heavy smoker, come with hemoptysis, loss of weight. Patient saying, am I having lung cancer? You say, well, I understand your concern. Being a smoker for many years put you at a higher risk, but it could be anything else. You can't make it like as a final diagnosis. To be sure, I need to do this and this, like something of picture or urine test or blood test. Next visit, I will tell you. Then you say, am I addressed your concern? If you have not get any impression, don't worry to speed your answer out and don't give any conclusions. Just say it is hard to tell you right now what is going. I need to run this and this and this, and next time I will tell you exactly what is this. If this sound good, this slide is just like you have to know exactly have you will say the laboratory investigation or other investigation to the patient in a simple way, in a simple way, away from saying like medical term. Like for example, if you're saying ECG, it is a machine that monitor and record electric activity of your heart. If you're saying CT, it is a high resolution X-ray machine. It takes picture that analyze by computer to give. If you say MRI, it's an imaging machine that use a magnetic field to create detailed picture of the body organ. If you said endoscope, it's sent tube with a camera as it ends that allow us to visualize. If you say biopsy, you have to say we pick up a small piece of tissue to be examined. Culture, so in every type of investigation, you should not say the patient like in medical. You have to make it like simply. Around the treatment option, if the patient say like during while you just enter from the room, doctor, can you give me anything for the pain? You have to tell, I understand how do you feel about this pain, but I will run my history and doing the physical examination as soon as I can. Then I understand the condition, what causing you the pain. If at the end I understand your concern, but giving any medicine right now may give a chance, may change the underlying cause that make it difficult to diagnose. I need to do this and this. As I have a final diagnosis, I'm going to give you the proper medicine. We're going to do this as soon as possible. How this sound to you? Doctor, can you give me antibiotic? I understand your concern, but I need first to run some blood test, take a picture of this, taking urine test, because like if it is a bacterial infection, antibiotic can be suitable for this. If not, this is will not be of benefit for you. So if you asked about like something not evidence based or non-pharmaceutical medicine like herbal or acupuncture, you have to say if even the patient saying something you never know, you have to say to my knowledge, I don't know exactly like if this is like evidence based or if approved for this, but if you don't mind, you can give me the name and I can Google it for you and find if they have evidence or not. For example, if the patient saying, "Am I need surgery?" You have to tell him like it's one option, but still we are so early to decide. We have to run this investigation and then finding what exactly present. Like if the patient asking about health insurance or social problem or saying that I don't have enough money, so you have to tell him, I understand your concern. If you don't have health insurance, it doesn't mean that you will not be given a proper medical care. I am going to call the social worker for you. So the social worker is like occupying by doing this. Like if she left her kids at the home, I could not be admitted to the hospital. Then the same, you have to tell her, we have here a social worker. I can let you arrange with him, and everything will be fine with you. So we have special kinds of patient who is worried about his or her disease. Example, doctor, I can't sleep from this doctor. Answer is, I understand your concern. We are going to do everything possible to make you feel better. Or we here we having the possible, the best doctors, the best teams that can helping you in this. Am I going to die? You have to say why you are thinking in this way. He will say, doctor, because I am really scared. My father having this. Then you have to reassure him and tell exactly that you have a wonderful professional team here that willing to help him. Angry like a patient saying, doctor, I am waiting for a long time. So you have to tell him, I understand your concern, but uh, we are doing here like we're having a lot of patient and we are caring about each patient. This is what I'm going to do for you. Um, if, for example, uh, after finishing a telephone encounter with a mother who is worried about her kid, you asked her to bring her kid immediately to the hospital to do a physical exam. She may say, "Doctor, I don't have a car. How can I come?" Or she may say, "I have his sibling here and I can't leave them as alone. What I am going to do?" So, response, please, it is serious. Your child is sick, and if you can't come, you can call 911 right now. So we finished the challenge question. We are going to respond to reaction. If the patient being to cry, allowing something, allow sometimes for him to cry and keep silent and just like watching him, offer him like a tissue. If the patient become angry, acknowledge the patient position and avoid talking about it. If the patient refusing to accept the diagnosis, explore the reason for the patient denial. Empathize with the patient, give him time to adjust to the new information. So I understand how this is difficult for you. I know you can't like doing this. It's actually very hard for anyone to having this information. So you have to let the patient accepting this and empathizing with him. So when you're discussing the prognosis, then say exact time. For example, you can say, Mr. Mohammed, your health and safety is our main concern. We are here offering the best doctors, the best medication. So I am going to tell you that we are going to start the treatment, and then we are going to see how body will be responsive for this. So please don't worry, we are going to do the best for you. If he's saying, asking about the prognosis, and you still, there is a lot of factors that can affecting your opinion. If you want to say, you can say it runs in months, it runs in years, but not to be exactly like shocking for him. Remember, keep calm, never be angry, address any concern for the standardized patient, don't give final diagnosis, keep a nice smile, keep a good eye contact, be gentle, humble with your patient, don't forget to wash your hand. This is like the success of you is a new global and diverse workplace require excellent communication skills. So today is what's our goals. Our goal was to address how we can communicate well with the patient, how we can absorb the patient feeling, how we can answer the patient questions in a good way. So I wish you all the best. Thank you.